again and welcome to our presentation for today. And as we all know, we are using this week to discuss a very important things regarding to marriage and not necessarily being married, but it goes across whether you are single, whether you are preparing to get married or you are married. But today we are just considering one most important topic, which is premarital testing, a pathway to a healthy marriage. And my name is Dr. Samuel MENSAH, and I'm going to take you through the presentation for today. So at the end of our presentation for today, there are some basic things that you are supposed to know and get the understanding regarding the whole topic, as in the pre-marital testing, the type of test you are supposed to know, why you are supposed to know all those ones. So at the end of the presentation, my objective to you is that you would understand the importance of pre-marital medical screening. Before you get married, there are some kind of medical tests you are supposed to do, why you are supposed to do them, the importance of you doing them. Then we also consider the essential tests recommended before marriage. What are the various tests you are supposed to do? That is what we are going to also consider. It's not all kinds of tests that you just go ahead and do them, but there are some specific tests that you're supposed to do. So we are going to consider them and then we go ahead with that. Then also we are going to recognize how test results influence family planning and marital harmony. There are some kind of tests that needed to be done that will determine whether you can go ahead with your marriage or you can't go ahead with the marriage. And there are some type of tests that you have to do to determine whether the child that you are bringing forth, because every marriage, people aim of bringing forth children, unless there are some specific reason why people enter into marriage without considering childbearing. But majority of families that, or majority of people that enter into marriage, though the unity is there, the love is there, and all those kinds of things is there, but there are certain things that decisions that has to be taken, and all those decisions can be taken when certain kinds of tests are being done, especially in terms of family planning and in terms of child spacing and all those kinds of things. Then we are also going to consider the appreciate of psychological, cultural, and spiritual aspects of the test. So, what are the psychological benefits of doing those kind of tests? What are the cultural background of doing it? And then the spiritual aspect of doing those kind of tests. Then we are also going to learn how to counsel couples through results ethically and supportively. So that's what we are going to consider at the end of the presentation. And I strongly believe that with the help of God, we'll be able to cover it through within the limited time that we have. So why premarital testing? Why do one has to do all those tests before engaging into marriage? Or what are the benefits? What are the importance of premarital testing? That's what we are considering now. So one, to identify the health risks of anything. So you see, prevention is better than cure, as a popular statement goes. Then also early detection of all those kinds of health risks will help one to come out from certain kinds of conditions and certain kinds of sicknesses or certain kinds of anything you can really think about. So kind of tests is to avoid some kind of casualty that follows afterwards. Is to prevent anything that will impose some kind of condition over your life. Then we also do those premarital testing because it protects the future of the offspring. So there are some children that will come in as a result of the conditions that the both parent and both parents, because they came together, it brings them forth. So sometimes those premarital testing is important to protect the offspring that we are having. If your child that you are having is suffering from certain kinds of condition of which could have been avoided, it's far better than not knowing, then the children should just comfort like that. So the premarital testing is important to secure you, the parent, to help you, the parent, to have a peaceful family, to have a peaceful marriage without having children that become a burden. And you know, some kind of conditions are there that drains a lot of people's finances. But if we are able to check all those kind of tests and we are able to avoid those kind of tests, it helps you to come out from that. Then you also consider the reason why we do the premarital testing is to prevent marital strife, some kind of misunderstanding, quarreling. You see, the reason why people going for divorce and other things just because of maybe some miscommunication, some form of misunderstanding, and all those kinds of things. Now, if certain measures were put in place before the marriage went through, the rate at which we get divorced will reduce, and those deep misunderstanding would have reduced. Though it is being said that every marriage there is an up and downs and all those kinds of things, but those kind of misunderstanding can also be avoided. So the reason why we do premarital testing is to clear those kind of misunderstanding. There are certain people that they do love each other, and before they enter into marriage, and then all of a sudden they tell them that, oh, you can't be together, and they feel some kind of way just because they didn't pass through the godly pattern of getting married, or they didn't pass through the godly way of the process of how to actually get married. So the reason why we do this premarital testing is to avoid those kind of miscommunication, misunderstanding, unknown condition that one may be hiding, or not necessarily hiding per se. There are some people genuinely they didn't know before they enter into the marriage. That is fine. But there are some people that are not faithful to themselves and they still want to get married and they don't inform the other partner, then they get into it. And when it happens that way, it affects the marriage. So premarital testing is very, very, very important. Then the other reason why we do this kind of test is awareness of fertility status. There are some people that enter into the marriage and because of certain one or two conditions, they can't give birth. They can't give birth. So if you do the premarital testing, it helps to know whether actually you can give birth or you can't give birth. And even if you can't really give birth on your own, what are the possible ways or means that you can get children? So that is why it is essential to do those kinds of testing. And when you do those kind of testing, and then you know that okay, this is my condition. So when I enter into the marriage, this is the next step I'm supposed to take. Down for you not to be aware, and when you enter into the marriage, because you are not prepared for it, you enter into it, and probably you are supposed to go and do some kind of testing and all those kinds of things, and it is draining you. So this premarital testing is very essential to help you to know what you are entering into, whether you go ahead or you stay out of it. Then it's the ensure transparency and informed consent. You are going to marry someone. There should be transparency between the two of you. that this is who you are, this is what you have, this is how it is. And when you're able to inform each other and both of you know that this is how the condition is, probably, or even not probably, there are ways and means to solve those kinds of issues. You see, this world, there is no condition or state of life whereby there is no solution to it. Everything there is a solution to it. And with God being on your side, being faithful to yourself, and being faithful in your marriage, and being faithful in every aspect, it helps you a lot. Then we also look at the reason why this premarital testing is important is because of biblical and religious principles of wisdom. It is very, very, very essential that you do those tests to back you in Christ. You see, uh, there are some conditions that comes upon our life because of disobedience. Because of disobedience. Now, when you pass through whatever church you are going through, they are laid down principles and laid down steps that they place down to help people to get married. And the testing that they added to it is to help the members of the church, is to help the members of the community, is to help the whole generation that comes after. If you try to cut corners around it, it won't help. It won't help. God in His own wisdom has given your leaders the pattern, and God in His own wisdom has helped you, has selected leaders to guide you on how to follow those kind of procedures. So if you decide to cut corners around those things, it won't really, really, really help. So these are the reason why we do this premarital testing. So early detection of high risk, protecting the future of our offspring, and prevention of marital strife, confusion, and miscommunication. Then awareness of fertility status, and then ensuring transparency and informed consent. Then biblical and religious principles of wisdom. So, what are some of the essential things that one has to consider before entering into marriage? Or, yeah, the essential things before entering into marriage. One is the blood group and the ritus factors. So, each and every individual is having a blood group, whether you are A, whether you are B, whether you are AB, or you are O. Every individual is having one of these. You can't have anything different from this. And each of your blood group is having a ritus factor, which is the negative or the positive. So why why do one do this thing? Is to find out whether you are compatible. Because now if you are a male and you are negative or you are positive, and you are a female, you are negative or positive. So let me use um, the negative for the female and then the negative for the male. Now, when you are negative as a female and then you are negative as a male, and you should bring forth children, there wouldn't be any issue in terms of um, the formation of blood for your child. But when you are a female and you are negative and you marry a man who is positive, it means that the man is introducing a new thing into your system, of which that is what the baby will take. So the reason why we do this test so that your first outcome of offspring, as in your first child, at certain period within your pregnancy, there are certain injections that you take Then after your pregnancy, within 72 hours, there are certain injections that you need to take so that whatever the man is introducing into you does not fight whatever you don't have. Because it's the two of you, your blood that joins together, then it's determine which one the child will come forth with. So now, you, the woman that you are negative, that you don't have any of the resource factor, the man introduces it into you, it begins to fight whatever you are trying to form for the child. And there are some aspects that the child does not make it, or let me say the fetus does not come forth because of that kind of incompatibility. So when you are able to detect it earlier, then whoever is taking care of you during your pregnancy will tell you as and when you take all those kinds of injection. So that is for a negative woman and then a positive man. But if it's positive, that means the woman is already having it, the man is already having it. So there is nothing that is going to happen to it. So we have something called hemolysis disease of the newborn. That means the child blood, it's all the time there's issue with the child. All the time there's issue with the child. So, and if a woman who is negative does not take the injection as and when it is needed, whereby the husband was positive, the first child comes out safely, but the remaining children become an issue because the man has already introduced something into you, whereby it will keep fighting whatever offspring that you are bringing. So it is essential to do those tests if you really want to have a continuous children. There are some people that the first child comes out safely, then the remaining one will not really come out very well. And there are some even the first child does not come out very well. So it is really, really important to do those kind of tests. Then there are some by default, not by default, but by mistake, they didn't know. And let me put it this way, when they were in the world enjoying themselves, they were negative and maybe had an affair with a man and pregnancy came in, they terminated the pregnancy. But lack of knowledge, they didn't know anything about the anti-D injection. Their remaining children become some way, become an issue. So it's essential to really do all these tests before you enter into marriage to avoid any future problem in terms of pregnancy, in terms of childbearing, or anything that pops up or comes afterwards. It's very important to do it for your own safety and for your own good. The next one is genotype testing. So the genotype testing is everyone is having a genotype. It's either you are AA or you are AS or you are SS or you are SC. So the SS and SC is talking about sickle cell, and the AA means that if you are having a genotype of AA, it means that you can marry any other type of genotype because you don't have the sickling nature or sickling state. So AA and AA is safe, it's very good. There wouldn't be any issue. And then AA and AS is also safe because the A can bind with the E, and then the other E can also bind with the S, which is also safe. But the AS cannot bind with AS, or the AS cannot bind with SS, or the AS cannot bind with SC. When those ones join together, there's a risk of having children who are having sickle cell. And sickle cell is a whole different thing on its own. It comes with its own race, it comes with its own condition, nature, it comes with its own anemia state, and it's a whole lot. There are people that are having sickle cell, and if they should tell you their story during this season where there is raining all the time, the weather is very cold, if they should tell you the kind of challenges they are going through, you will never wish to be in that. And that is why it's very essential to do the test to avoid all those things. Now, those that are sickle cell shouldn't see themselves to be a curse. They just because their parents didn't get the adequate education or the proper education. So it is good that you are on this platform and then getting to know and understand the risks that are involved. So when you know the risks, you help to protect yourself afterwards. So one of the major tests that has to be done is the HIV and AIDS testing. And most often, if you don't do that particular test, and maybe your husband or your wife should later find out, it becomes a whole lot of issue and can destroy your marriage or can destroy a relationship you built over years. And HIV education has been widely spread that the negative stigma that we mostly give to them, and then the kind of thoughts that people have concerning HIV is now reducing because of the advanced medicine that we are currently enjoying. So, but irrespective of that, it's very important to do the HIV testing because there are some people cannot take medications every time. And when you are having that condition, there are a whole lot of things you are told not to do. You are told to be cautious in a whole lot of things. Unlike people that are not having that condition, they can live freely, they can do everything that they want. But those that are having that condition are restricted one way or the other in some aspect. So it's very important. So sometimes we do voluntary counseling and testing for HIV. So in voluntary, we just counsel you before we do the test for you. And you should also know that if someone is having HIV, it doesn't mean that that's the end of the person's life. The person have a longer life. The person enjoys life afterwards. I heard of a story that someone had HIV test done and it was indicated positive at within the 30s, and the person died at 89 or 90 something years. So based on this, you should know that when you're having HIV, it doesn't mean that your life has come to an end. You just have to follow the proper education, the proper treatment, the proper training that people give so that your way of life becomes as just like the way everyone is doing. So we do it to protect both partners and also the future children. So if someone is having HIV and go in for the person get pregnant, even during the pregnancy and during delivery, there are a lot of medications that is being done so that the child will not be affected. Then it allowed early initiation of being on the ART drug if needed. So you start with the antiretroviral treatment as early as possible when it's being tested and the type of medication that you're supposed to take. Now, what is the test for? So one, to detect the antibodies and sometimes the antigens that are in human. So we do the test to detect whether you have the virus or you don't have the virus. Then we also do to know the extent of which the immune system is being attacked. Then treatment is given to us that. So why is it important to do the HIV test? One, HIV is a chronic but manageable condition if detected earlier. It's a chronic condition, but it can really be managed. Just like the way I said, someone was detected positive within the age of 30s and then died within the 89 and the 90s, thereabouts. So if you do the test and then it comes out that you are positive, they start the ART drugs very fast for you, and it helps you to avoid your children or your offspring from getting it, or even your partner from getting it. And it doesn't also indicate that your life has come to an end, just like the way I said it earlier. So it also reduces the risk of transmitting between partners. So you do the test so that one will know that, okay, if I'm having and I'm on this medication, I'm on this treatment, I'm on this guidance, my partner will not be having it, and then your future children also will not be having it, because it's easier to transfer it from the mother to the child. But if the education is given, it helps. Now, what are the implications if it's positive? Partners counseling is very essential. So if it's positive, you need to counsel the partners very well, so that if both are having, they know what exactly to do. If one is having, the one that is not having, education is given to him or her, or even the one that is having to, education is given to him or her, so that they live peacefully and happily in marriage. Then we also delay the marriage for future evaluation and decision making. So, especially if one partner is having the other partner is not having, their marriage is being delayed for future evaluation and proper decision making, not just rushing into the marriage, but proper decision has to be taken. Then both partners should understand the risks and preventive options. So you have to understand the risks that you are going into it, and then you have to know how to prevent the transmission. When you consider all those things, it helps you. So the next essential thing that has to be done is hepatitis B and then hepatitis C. The reason why we do this test is to protect the liver. You see, the liver play a very vital, important role. Anytime there are some kind of chemicals that goes into your system, or any toxic that goes into your system, it's the liver that has to separate it and break it down. So the liver plays a very vital role, and the hepatitis B and then the hepatitis C mostly affect the liver. So if someone is having that kind of condition, it helps for a faster and better treatment The reason why these tests are very essential is for you to know the type of marriage you are going into, or it's not even necessary like knowing the type before going to it, but it's like it's to help you yourself know your state of health. There are some people that has not been to hospital for checkup before until maybe they get ready to marry, then they has to do this test before they get to know that okay, this is what I'm having, this is what I'm not having. So the hepatitis B and hepatitis C are very important, and it's being transmissible through blood, through sex, and then even through childbirth. And thank be to God, they've been able to get vaccination or treatment plan if it's possible, if it's positive. So there are treatment for that. And when you test and then it's positive, they know what to do. And when you test and it's negative too, they know what exactly you should do. There are various teachings regarding to the hepatitis B and hepatitis C, as in going deep into it. So, as and when we are taking only the hepatitis B as a lesson or a topic, then we will dive much into it. But generally, the hepatitis B and C affect the liver, and the liver function is to detoxify any toxic that comes into it. So if it affects, it means that the function of your liver is being diminished. When it happens that way, any condition that comes into it can easily affect you. So why is it important to do this hepatitis B and hepatitis C? Both viruses affect the liver and can lead to chronic liver disease like liver cancer. And I don't think anyone really wish to get cancer. So you do those tests to know your state of health, whether you are having, and if you are having, at what stage has your infection gotten to, and what exactly can be done towards that. When it's being done that way, it helps. Then you know the type of treatment they are supposed to take. Then also, um, it helps to know how to have sex, and it helps to know how not to transmit it to one another. So it's transmissible sexually or maybe through some needle or whatever. Then what are the implications if it's positive? Spouses are required to take vaccination, especially for safer, to be on the safer side. So you go in for the vaccination and a safe practice. Then an ongoing liver function monitoring and treatment is very necessary. So you consider all those ones too. There are times that some tests are also considered, like the syphilis, gonorrhea, and some other sicknesses. So we do those kind of tests and then we treat it before marriage, because majority of those hidden tests can prevent one person from becoming fertile. So the fertility level of a person reduced, the person is not able to give birth at a certain stage, and then treatable if detected earlier. So when you detect it very earlier, it's very um, essential, and it can be treated easily and faster. The other aspect is the fertility assessment. So it's very important because every marriage people want to give birth. So it's very, very, very important. So you assess your fertility level, and then it does a hormone profile, analysis for the men, and pelvic scan. If there is fibroid, you take away the fibroid. If any other thing that is also needed, you take it out. Then the last test, or even not the last test too, but the test that has to also be considered is tuberculosis screening. So that one you do the chest X-ray or marital test, and that especially if it's in area where people are constantly diagnosed of having tuberculosis, because it can be chronic and affect you in long term. So early detection also helps in early treatment for a safer life. So you also consider blood group and hypertension check. So in terms someone is having a diabetes, then you know how to manage the person. This type of diabetes that the person is having, is it type 1, type 2, or however the diabetes is, then treatment is being given for the person to be safe. And you also check for hypertension, so whether the person is having the BP is very high or extremely high or manageable or whatever. So you see, you do all these steps so that the early stage of your marriage, you be in love, you be in peace, harmony, nothing, not moving up and down with hospital year in, year out, and all that. No. Then the next one is chronic disease awareness. So based on some other tests that has to be done, the type of condition that a person is having, and then the treatment that has to be given. So there are proper education that are being given, or awareness is being made on some kind of condition, so that the person can really prepare him or herself on those kind of conditions. Then you also look at lifestyle planning as a couple. So your single life, there are certain things you do, but now that you're married, there are certain things you can't do. There are certain type of food you take in. Now that you're married, you can't take those kind of food. So all those ones are considered to help build a godly home and a peaceful home. So you need to prepare yourself psychologically whenever you are entering into marriage. There are certain people that goes into marriage and they have this mental issues. Then the reason why we do this pre-counseling is to know whether there is a congenital abnormalities. The children that you are going to bring forth, are they going to have some kind of condition that you will not be able to bear it or not? Then to find out if there is cancer, how you go about the cancer. So it is very essential. So the next thing is communication and counseling aspects. So before any blood test is done, or before any test is done, there should be some form of consent form. So you have to give the go ahead that this test has to be done. And the result that is gotten from the test is mostly confidential. It's not being shared with anyone. It's mostly confidential. It's not judgmental. And before the test and after the test, there is counseling. You are being the results is being explained to you. The outcome of the results can be explained to you. Then if it has to be referred to a specialist, they refer you to a specialist. There are certain common questions that HIV people do ask, that if I marry HIV positive, or no, can I marry a HIV positive person, or can a HIV positive person marry someone? It's possible with proper care and precaution. Then be on your ART drug. The virus is being suppressed. You enter into your marriage and everything. You live your normal life. Everything become normal. You follow the instruction that is being given to you. You are okay. There are instances that someone will also say, we are both AS. Can we marry? You need counseling, and it has to be cautious because you can marry, all right, but what if the SS join together? Then sickle cell comes. Then someone will also say, what if I'm infertile? You need counseling. You need to find out the cause of the infertility. Then if it's a medical intervention that has to be done, it will come inside. Whatever being the case, it has to come inside, and then treatment will be given to you properly. So I would say premarital tests are not to disqualify the love that you are having, but it's to protect your life. So we don't do this premarital test in order to destroy the love that you built for some years and other things, but in order to put you on a safer side. That's why we do those kind of premarital tests. Then also, every couple deserves a safe and informed and healthy marriage. So you deserve a safe and informed and healthy state of your marriage. You don't have to enter into a marriage that is full of sicknesses, is full of problems every day, moving up and down to clinic, to hospitals, to get some kind of treatment. Then this whole marriage issue is for you to get the medical and spiritual guidance to work hand in hand in your marriage. So marriage is not just an emotional journey. It's a biological, psychological, and a spiritual covenant. Preparing well, honor God, your partner, and your future family. So thank you very much, and this brings us to the end of our presentation. I strongly believe that we've learned a lot, and we are going to put them into practice.